Good morning, everybody. This is Nurse Eunice with Florida Train Academy. And in today's video, we're going to be reviewing practice questions so that we can help you better care for a patient with diabetes. So we'll give you a few moments to receive your notifications and we'll get started shortly. All right, and so here is our lead-in, everybody. Maria Garcia is a 68-year-old female admitted to the hospital with increased thirst, frequent urination, and unexplained weight loss over the past month. So we call that polydipsia and polyuria. She's urinating and drinking way more than she normally would. Those are signs of uncontrolled diabetes. She also reports feeling tired and having blurry vision. She has a history of type 2 diabetes, hypertension, and hyperlipidemia. So her blood pressure is higher than normal, and her cholesterol, her fats within her bloodstream, they're also elevated. And you are the CNA or PCT that is assigned to care for her. So let us begin. Good morning, Gigi. Good morning, Michelle. All right, so question number one, team. Which of the following is a primary difference between type 1 and type 2 diabetes? A, type 1 diabetes can be managed with diet alone. B, type 2 diabetes typically occurs in children. C, type 1 diabetes requires insulin therapy. Or D, type 2 diabetes does not require monitoring the blood glucose levels. What do you think, team? There are two different types of diabetes. And good morning, Pamela from Kenya. And Gigi, you're not late. You're right on time. We're revealing the answer in 3, 2, and yes. So it is C, everybody. We need to teach you about the different types of diabetes. So type 1 diabetes or juvenile diabetes requires insulin. The pancreas is not producing any insulin. So type 1 diabetes is an autoimmune condition where the body does not produce insulin, making insulin therapy essential. Most adults have type 2 diabetes. And so their diabetes begins with insulin resistance. So their body's making insulin, it's just not doing what it needs to do. And so it can be managed with lifestyle changes, oral medications, and or insulin, depending on the severity. So at most adults, we start off with, hey, change your diet. Hey, we'll give you a pill to manage your diabetes. And when those don't work, that's when they'll start having to receive insulin injections. So that's the difference between type 1 and type 2 diabetes. Question number 2. Which symptom is a sign of hypoglycemia? Hypo, that means it's lower than normal. Glycemia is the level of sugar that's within the bloodstream. So which is a sign of low blood sugar? Is it A, fruity breath, B, extreme thirst, C, shakiness, or D, frequent urination? Kamala, I'm so proud of you for passing your CNA test. I'm giving you my nurse applause. Yes, so proud of you. All right, so I see Enoop says B, Ebony says A, Glam says C, Jeanette says C, Michelle says C, and for you all who chose C, you're absolutely correct. So whenever someone has a sign, whenever they have a low blood sugar or hypoglycemia, shakiness along with sweating, confusion, and irritability are common signs that you might see. The fruity breath and extreme thirst, that's what's common when the sugar is high, not when the sugar is low. Question number 3. What should a CNA do if a patient with diabetes shows signs of hyperglycemia? A, offer a sugary snack. B, encourage the patient to exercise. C, restrict the patient's fluid intake. Or D, notify the nurse immediately. So proud of you all for getting up early on a Sunday morning and studying with me. Everyone has the correct answer. I mean, just straight up and down. I love it. You know that you have to notify the nurse because hyperglycemia can lead to serious complications. So, whether the sugars are low or high, either way, the patient can go into a coma. So, if you notice that someone's having symptoms of hypoglycemia, you're going to notify your nurse for further assessment and intervention. And as a reminder, CNAs and PCTs should not attempt to treat hyperglycemia on their own. And it's kind of hard to see, but you can always come back to this slide later and just review it. But we have the differences between hyper, that's with the arrow going up, and hypoglycemia, and that's on the side with the arrow going down. So hyperglycemia, excessive hunger, excessive thirst, weakness or fatigue, frequent urination, blurry vision, dry skin, sores that are not healing properly, nausea, sleepiness after eating. Oh yeah, they're going to go to the doctor, and that's when we're going to do their blood sugar test, and we're going to find out that the sugars are high. And now we're going to put them on medications, and if they don't eat regularly or if they're not taking care of their body, now they're going to start having signs of hypoglycemia, which would be hunger, shakiness, sweating, dizziness, fast heart rate, anxiety, blurred vision, weakness, headache, and irritability. So some of the symptoms are the same, whether the sugars are high or low. So when in doubt, get your nurse in that room. That's why she gets paid the big bucks. All right, question number 14. What is a common sign of diabetic ketoacidosis? That means that the sugars are just really high. DKA. Is it A, increased appetite, B, cold, clammy skin, C, deep, rapid breathing, or D, low blood pressure? And hi, Doreen from Dubai, who's waiting to take her final exam. I'm so proud of you. Good morning, Miss Karen. Oh, Augustine, I'm so proud of you. Yes, Augustine knew the answer, everybody. And Michelle, I see you too. So for this one, write it down. Whenever someone has DKA, it starts affecting their breathing. So the correct response is going to be C. They're going to have deep, rapid breathing, which is referred to as small respirations. It's a severe complication of diabetes that requires immediate medical attention. And then DKA is more common in type 1 diabetics than type 2. Question number 5, which of the following is an important aspect of diabetic foot care? A, soaking the feet in hot water daily. B, filing toenails straight across. C, applying lotion between toes. D, wearing tight-fitting shoes. And so if you're not aware, I'm a Floridian. And so our diabetics down here wear sandals and flip-flops. It's not a good look for a diabetic patient. So what do you recommend? We need to keep their feet taken care of. And everybody gave me the right answer. Yes, it is B, filing the toenail straight across, so filing toenail straight across helps to prevent ingrown toenails, which can lead to infections. So diabetic foot care also includes checking the feet daily, avoiding tight-fitting shoes, and not applying lotion between the toes to prevent fungal infections. And notice, I did not put a picture of a CNA here. I put a picture of a doctor, because some things are above your pay grade. And if the person has if they have diabetes, you, my dear CNAs, should not be messing with their toes or their feet. They need to go to a doctor. You let us know if something's wrong. You get that nurse in the room. And even as the nurse, I'm not fouling or clipping anything on anyone. I'm going to get the doctors who get paid the big bucks to do that for me. All right, so question number 6. What action should a CNA take if a diabetic patient becomes unconscious? Oh my God, Miss Garcia is not moving, but she's still alive. So you don't have to start CPR, thank God. A, do you place a sugary drink in her mouth? B, check the patient's blood sugar level? C, turn her onto her side and call for help? Or D, give her insulin? Ooh, what do you do? No, we cannot soak their feet. Their feet shouldn't be wet or moist because that's going to lead to deterioration. Augustine And Michelle, you all knew, and Anoop and Pamela. So yeah, it said turn them to their side, but just make sure you call for help definitely, because whenever someone's unconscious, that is a change in condition. You have to get that nurse there right away. So you're going to turn the resident to their side and call for help, because maybe this person is not unconscious due to their blood sugar. So that's why you need that nurse in there. It could be another reason why they're not responding to you. Turning a resident onto their side helps to maintain an open airway, and calling for help ensures that the patient receives immediate medical attention. CNAs and PCTs should not attempt to give oral intake or medications to an unconscious patient. Just because this patient has diabetes doesn't mean that this time when she's unconscious is related to her diabetes. It could be related to a seizure or something. So get that nurse in the room right away, and then she'll tell you what to do from there. Question number 7, how can CNAs help prevent diabetic foot ulcers? A, by ensuring the patient walks barefoot at home. B, by applying heat pads to the patient's feet. C, by massaging the patient's feet daily. Or D, by encouraging proper foot hygiene and regular inspections. All right, I see some D's, I see some C's, I see more D's, I see more C's. So it is a toss up. And for you all, we're not going to have them massage their feet daily. That's not necessarily a bad response, but the most correct response is going to be D, because when you look at this person's heel, there is a small cut on her heel. And the heels are really dry. So her massaging her feet, that may not moisturize them. It won't tell her if there's a change. So by encouraging proper foot hygiene and regular inspections, you can help to prevent foot ulcers, and it helps the patient by identifying and addressing potential problems early. I talked about us Floridians wearing sandals and flip-flops all the time. That's almost as close to walking barefoot. So walking barefoot and using heating pads can cause injuries or burns, which are dangerous for diabetic patients. All right, so question number 8, which of the following is the best action to take when a diabetic patient reports feeling dizzy and lightheaded? All right, so you're getting Miss Garcia up and you're taking her to the bathroom, and she says, oh my God, I feel dizzy. Do you A, ignore the symptoms and continue with the routine? B, encourage the patient to take a walk? C, give the patient a glass of water? Or D, have her lay back down and then check her blood sugar level? Of course, you're calling for the nurse. That's a given. But right now, you're in that room all by yourself. So I need to make sure that you and your patient are safe until that nurse gets there. And when I tell you everybody, Glam, Dinah, Dillip, Karen, Chrissy, Brenda, Marsha, Augustine, Paula, oh my God, Pamela, you all did it. Yes, it is D. Have the patient lay down and check that blood sugar. Because she may be dizzy because it's her blood pressure. So yeah, you can get that blood sugar check, but make sure you go ahead and put that blood pressure cuff on her arm and press that start button. And that way, by the time the nurse gets there, she pretty much has everything she or he needs in order to, know what's going on with that patient. So dizziness and lightheadedness can be signs of both hypoglycemia and hyperglycemia. So laying down prevents falls, and checking the blood sugar level helps to determine the cause, allowing for appropriate action. Oh, you're doing a great job. Miss Garcia is going to be discharged from this hospital soon. Question number 9. What is an important consideration when assisting a diabetic patient with meal planning? A, avoiding all carbohydrates. B, timing meals and snacks appropriately. C, limiting protein intake. Or D, skipping meals if blood sugar is high. Hmm. Glam Beauty Queen. Yeah, so Glam and Michelle. Perfect, perfect, perfect. You all did such a great job. You all know that we have to feed them regularly on a schedule, because when we have you checking those blood sugar levels so that the nurse can give the insulin's working whether or not that patient has food in front of him or her or not. So we have to make sure that we do B. We need to adhere to timing the meals and the snacks appropriately, because it helps to maintain stable blood glucose levels. We also usually ask that you give your diabetic patients a bedtime snack and that you check their blood sugars before they go to sleep. That is important because remember, the insulin's still working. And if we don't give them something to maintain their blood sugar before they go to sleep, they may not wake up, okay, because their blood sugars can drop severely overnight. All right, so here we go, everybody. We're progressing. After 1 week, Miss Garcia returns for a follow-up visit. And this is her new assessment. This is what you took. The blood glucose is 180. She reports feeling better with reduced thirst and urination frequency, but she's not been adhering to, it says she has been adhering to her insulin regimen, but finds it challenging to remember insulin doses. So you're not adhering to your regimen if you can't remember what dose to take at night. That's just my opinion. So let's keep going. Question number 10. What is the most important observation the nursing assistant should report to the nurse during this visit? Is it A, the blood glucose level of 110, B, the blood glucose level of 358, C, the patient's weight remains the same, or D, the patient reports feeling better overall? Yes, Ruth, Edna, Farida, Louina, Marcia, Dinah. Yes. Yeah, even though she feels better, her blood sugar is still high, you all. So the response is B. You need to let that nurse know that the blood glucose level is 358 because that indicates hyperglycemia or diabetes when the sugars are high. And this is a condition where blood sugar levels are significantly higher than the normal range. And here are your normal ranges. So when your patient wakes up, they haven't had anything to eat or drink, we expect their blood sugar levels to be, 70 to 99, even like the low 100s. But then after eating, a normal person who doesn't have diabetes, their blood sugar shouldn't spike all the way up to the 300s. We call that postprandial, and they'll usually go up to about 140. So you have to know these ranges so you're not freaking out every time a patient's blood sugar changes. So usually anything from 70s to 120s, we're okay with. If it goes, lower than 70 or higher than 140, usually it's going to be some type of orders in the system, and your nurse will need to actually intervene and give some medications if we can't get those sugars up or down. Oh, Mrs. Garcia, she will not take care of herself. So complications and changes in condition. Maria Garcia is admitted to the hospital with a suspected diabetic foot ulcer. Yeah, that's going to happen. You're not managing your diabetes. So her blood pressure is 148 over 90, heart rate 86, respiratory rate 18, temperature 99. At least her sugar is a little bit better. It's 250 today. She has a 2-centimeter ulcer on her left foot that's red and tender with purulent or pussy discharge. And she reports increased pain and difficulty walking. So yeah, she's about to be hospitalized. We're going to have to put her in the hospital for a few days. So question number 11. What should the nursing assistant do first in response to the patient's current condition? Is it A, clean the ulcer with an antiseptic solution, B, notify the nurse immediately, C, assist the nurse in ambulating to prevent pressure on the ulcer, or D, apply a sterile dressing to the ulcer? What do you do first? Remember, you're the first ones in the room. You get the vital signs. You see everything before I get there, unless it's an emergency. I am so proud of each of you. You all heard Nurse Eunice when Nurse Eunice told you that some things are above your pay grade. Yes, you're going to notify the nurse immediately. A diabetic foot ulcer with signs of infection requires prompt medical attention to prevent further complications. You go in, you get some vital signs, you look at that foot, you call that nurse because that's above your pay grade. Let the nurse deal with it. Discharge planning. All right, so after appropriate treatment, including antibiotics and wound care, Mrs. Garcia shows improvement. Look at that blood pressure. It is getting normal. It is 130 over 82 because she's probably in less pain. Heart rate 78, respiratory rate 16. She's afebrile. Blood glucose is 140. Remember, we're not trying to make her perfect. She's a diabetic. So that blood glucose level of 140 is perfect enough for me. The ulcer has been healing with no signs of infection. The patient feels better and is more mobile. And here's one of your last few questions. Question number 12. Which instruction is most important for the nursing assistant to reinforce during discharge teaching for a patient with a diabetic ulcer? Remember, you're the ones who putting them in the wheelchair, taking them to their vehicle that's awaiting for them in the roundabout. So is the response going to be A, keep your foot elevated as much as possible? B, continue taking your antibiotics until they are finished? C, avoid walking long distances? Or D, inspect your feet daily for any cuts or sores? I see D's, I see B's. Oh, it's a toss up. I see a lot of B's. I see a lot of D's. As a CNA, remember, you don't give medications, so you wouldn't give any advice about medications. So it is going to be D, inspect your feet daily for any cuts or sores. Daily foot inspection is crucial for early detection and prevention and complications in patients with diabetes, particularly those with a history of foot ulcers. And so, as we age, we have limitations with our movement, but that's still not an excuse for her not to see what her feet look like. She can use a mirror, which is why I love this image. So you can teach her to use a mirror to look at the bottom of her foot. She can raise her foot up so she can see it in the mirror, or she can even put her phone down there. Just, record your foot so you'll know what's going on with your foot. And here is some other diabetic warning signs. So what I like to think is act now. So act now, that's an acronym that stands for if the person's had an accident, they stepped on something, they stubbed their toe, and there's any changes in coloration, if there's any changes in the temperature, if you start having new aches and new pains, if it starts oozing, or if there's a wound, you need to be calling your doctor right away, because that is a sign that you have a diabetic foot wound, or we need to prevent it and stop it from getting worse. So my team, great job. Mrs. Garcia says, thank you. Let me tell you all the care you provided today. You monitor her blood sugar. You notified the nurse when she was unconscious. You provided diet and foot care teaching. And one of the most important things for a diabetic patient is you encouraged her to manage her disease, her diabetes, because if not, this cycle's just going to continue. She's going to go home, eat whatever she wants. She's not going to check her blood sugar. She'll be right back in the hospital. And so I am so proud of you. I want to say thank you. I was your charge nurse today. We had an awesome shift, and I will be back on here. I don't know when, because my mama's still in the hospital, but she's doing better. So I'll be back on here one day this week. I'll try to post it in advance. But for my babies who have their test this week, I'm praying for you. And for my babies who had their test last week and passed, congratulations, everybody. Our website is fltraining.com. And this is Nurse Eunice. Love you. Take care, everybody.